using an automated external defibrillator, AED. AEDs are carried on most commercial aircraft and are used for heart-related emergencies. Cabin crew are trained and qualified in the use of this equipment, which is crucial for responding to cardiac events and potentially saving lives. An automated external defibrillator can help save lives during sudden cardiac arrest. However, even after training, it can be difficult to remember the steps to use an AED correctly. To keep your skills sharp, we have created this step-by-step guide. You can print it out and place it on your refrigerator, in your car, in your bag, or at your desk. By doing so, you will be able to review the AED steps at any time at your convenience. Call push shock. Call push shock is what you need to do when you see someone collapse suddenly and they are unresponsive. This means that you must immediately call EMS, begin hands-only CPR, and use an AED to restart their heart. Step 1. Call. Recognize cardiac arrest and call EMS. Scene safety. Perform a quick survey of the scene to make sure that it's safe for you to help. Check for responsiveness. If the victim is not responsive and not breathing normally, they might be in cardiac arrest. If you have a phone immediately available to you, call EMS. Otherwise, ask someone else to call emergency. In either case, begin CPR as soon as possible. Step 2. Push. Perform CPR. Start CPR. Push hard and fast on the center of the chest while someone is calling 911 and ask another person to get the AED. Step 3. Shock. When the AED arrives, follow these steps to use the AED. Switch on the AED and follow the voice prompt. Expose the victim's bare chest. Apply the electrical pads to the victim's chest as indicated by the instructions. If a victim has excessive chest hair, you may need to remove this using a razor to ensure good contact of the pad with the skin. The pads are very sticky. If using gloves, take care that the pads don't become stuck together or to your gloves. One pad should be placed on the upper right side of the chest. You should place the second pad a few inches below the left armpit on the lower left side of the chest. If necessary, connect the pad connector cable to the AED. Follow the visual and audible prompts for the device. The AED will analyze the victim's heart rhythm and decide whether to deliver an electrical shock. If the AED wishes to deliver a shock, ensure there is noon in contact with the victim before the shock is delivered. Resume CPR if instructed to by the AED until the device gives you further instructions. The AED may deliver more than one electrical shock or instruct you to alternate between performing CPR and delivering shocks. Always follow the instructions from the AED until the arrival of emergency medical help. If possible, keep a record of how many shocks the AED has delivered and hand over this using AED on a child. As a child, the shock's energy level is attenuated, reduced, compared to an adult's standard energy level. For children, the energy is generally reduced from 150 joules to 50 joules. Depending on the AED's manufacturer and model, the attenuation may be preset into separate pediatric electrode pads or may be integrated into the AED and activated using a button, key, or other switch. If your AED requires a separate set of electrodes, you will need to install the child pads during the emergency, power on the AED, and listen to the voice prompts just like you would for an adult patient. You only need to flip the switch on your AED to switch to child or pediatric mode if your AED allows you to use the same pads for adults and children. In addition, children's pads are placed differently than adults. The steps for using AED on child is mentioned below. Follow the instructions on the audio screen once the AED is turned on. Ensure the patient's skin is dry by removing all clothing around their chest. Press the child button or insert the child key into the AED. Attach the pediatric pads if available. When attaching an AED to a child, the pads should be placed anterior-posterior or front and back, which means placing one pad in the center of the child's chest and the other pad in the center of their back. For specific electrode pad placement instructions, refer to your AED's owner's manual. AEDs usually have an image printed directly on the electrode pads that indicates where they should be placed on the patient's body. You should allow the AED to analyze the child's heart rhythm. Deliver a shock if needed. If the AED determines that the patient is in cardiac arrest and that a shock is needed. As the AED delivers a defibrillation shock, make sure no one touches the person. Perform CPR and reanalyze. Continue listening to the AED until EMS arrives and takes over the rescue. In the same way as for adults, if the AED cannot find a shockable rhythm, CPR should be continued until paramedics arrive.